The indication from the team, this is the EPI team collecting the data from our centennial sites across the country, is that the increase in suspected or confirmed cases is taking place at a decreasing rate. Now, what's the ray of hope in that? Is that we are expecting, therefore, that it will taper off and then hopefully decline to what would be more in keeping with the average rates in the country. Now, it's still early days, and I don't want to go out on a limb and predict. It's not my job so to do. But I believe that the work on the ground is bearing fruits.
Dr. Dawes, good morning.
Good morning, and good morning to all the listeners.
Welcome to Portland Spice TV.
Yeah, man, a pleasure.
The Minister of Health was just on a while ago talking about the outbreak of leptospirosis and all that is happening down on the western side. Give us an update of what you are seeing on the dealings or the managing this conceived breakout, and what are some of the things that we should be doing?
Well, you know, I believe that the press conference and the public service announcements about what are the signs and symptoms of leptospirosis and how you catch it and how you prevent it were too late. That discussion should have started from in the immediate aftermath of the hurricane, because we know historically that this always happens.
Yes.
Every time you have rats being displaced, they move nearer to homes, they infect dogs, cats, cattle, and humans. They contaminate food. So it doesn't take a genius to know that this would have happened. And if you know it is going to happen, you immediately get out there and start to prepare for it. You advise people what to do and advise them to seek medical attention once it starts to get into signs of the serious form of the disease, which can kill you. You also want to ramp up testing capabilities so that your samples that you send off, they come back fairly quickly so the doctors and nurses can treat specifically leptospirosis rather than operating in a vacuum and not understanding clearly what is the nature of the disease for the patient in front of them. We're seeing where there are several suspected cases of persons have died, but it is not confirmed, and that's because they haven't gotten back the test results. So it means that there is a gap with testing. With respect to getting people out of the exposed areas, I don't think that we are doing enough. It is a multi-agency approach that has to be the way forward, where we ensure that there is adequate sanitation, there is adequate garbage take-up,
But
as well
Dr.
as to
Dawes, you
get
see any
people back
plan?
into homes.
Let me just break you a little bit. You see any plans to getting people out of the areas, because you just mentioned that a while ago?
I don't know. As a matter of fact, what we're hearing is that they're planning to move people out of shelters. So where exactly are you moving them back to? Are you moving them to a house with a tarpaulin covering it with no door or window, where you can have rodents coming in and out at will, where food sources cannot be safely stored because there's no cupboard available? We don't know exactly what is happening. And there are some people who, their homes having been destroyed completely, the shelter is the only home they have now. Do we have space in the infirmary to move them, because there are no social cases and they have nowhere to go? I've met personally some people like that who if they don't get accepted by one of the infirmaries, they're the homeless. So I'm not convinced that there's a comprehensive enough plan. I don't think that the meetings taking place in Kingston to decide on the fate of the people who are in the most affected areas is the best way forward, because they're not including persons who are who should really and truly be forming parish disaster committees, the JPs, the political directorate, the church, community leaders, the presidents and chairs of community-based organizations. They know the people, they know the communities, they know all of the areas. They should be involved. They should have at least a representative with a seat at the table when these decisions are being made. But we are just hearing about decisions being taken at the top, and everything is being concentrated now in the office of the Prime Minister. And then the National Reconstruction Body, it is going to be again a concentration of powers. And this is not an inclusive way to approach the problem that affects such a wide cross-section of people: business people, rich people, poor people, old, young. It's not inclusive and broad-based enough.
Dr. Dawes, as a medical doctor, trained in the field, and a parliamentarian, have you been invited at any time to sit down with the minister, the heads of the health department, to you personally have a feel of what they are doing, and you could also make suggestions to them? Have you been invited to anything of the sort?
Well, yes. In all fairness, the minister invited me to a meeting, and I got a presentation from the technocrats as well as have discussions with the minister himself.
Yes.
And I am satisfied that in terms of a restoration of the health facilities, we are on track, and we have seen where the deployment of field hospitals and field clinics has done a lot to improve on the services that are available to people health-wise. But remember, this thing is a public health issue. So whereas the hospitals might be getting back up to running, even with limited bed capacity, 70% in some instances of where they used to be. The issue is public health and primary prevention, which means that it is not just a Ministry of Health issue. It is a Ministry of Local Government issue.
But that's
it is
the
a
question
Ministry
I
of
want to
Water
ask.
issue.
You said
but there's no broad-based. The PNP had asked for a committee to be formed that would have all of these representatives, as well as the political director, a private sector organization. And this would be the vehicle through which decisions would be taken, information would be processed. They refused, and they wanted an oversight committee in Parliament which would exclude everybody else. And that is what we objected to.
Well,
because it is not
Hold a second. I just want to take you back to that meeting you said you had with the technocrats and the minister. You say you are satisfied that the health facilities will be coming back. But what about the plans to deal with any kind of prevention? Because, I mean, as we know as Jamaicans, a ounce of prevention is better than 1,000 pounds a cure. How was that, or was that in the aspect of the discussion you had with them?
Well, so there is a plan to ramp up fogging, especially when you're looking at vector control for dengue, chickpea, which I'm very concerned may come soon. So they have started to look at getting vehicles for vector control. Some were destroyed, flood damage, etc., for some of those vans. And they are looking at ramping up the fogging teams and outsourcing to some private contractors. But and the public education has started. My criticism is that it started late, after the outbreak was announced. But what is really needed with prevention is getting people out and securing them.
Hold on. What do you mean by getting people out?
Of the worst affected areas.
So you can't be telling people evacuate some of the people out of those areas.
Yeah, you can't tell people not to bathe in river water when river water is the only water they have to bathe in and drink.
So hold on, Doctor.
So it is not just a Ministry of Health issue.
Right.
You know, the government as a whole.
Are you aware of any evacuation that has been done by this government?
The only people who have been evacuated are really who have evacuated themselves to the shelters. And the issue now is the government is trying to get people out of the shelters without addressing the reasons as to why those people evacuated out of their homes and went into the shelters. I don't think there's a coordinated plan. And I mean, when you look at so simply look at resources. They're talking about ADPEM having hundreds of millions of dollars, and we're a month out from the hurricane now. They
Yes.
are deciding how to spend that money or how they're going to go through procurement to spend that money. And you have people who are still living in marginal areas. You have a situation where JPS is being lent 24 billion Jamaican dollars, which is basically all of the insurance money that we got. 24. I don't like this thing about 150 million US because people don't
24
understand.
billion Jamaican dollars.
24 billion. We
Yes.
curse about Cornwall Regional, that Cornwall Regional overspend. This money that is being lent to JPS is the same as what is going to take to finish Cornwall Regional Hospital. And while we're prioritizing that, there are people still scavenging.
But
And at the same time, you have people getting so much care packages that they can't open a corner shop. So you see where resources are concentrated in ADPEM and can't get to the people. You see where money is coming in and we're taking it and lending it to a private company that is foreign owned mostly. And we're seeing where aid is getting to the same set of people over and over, and others are suffering. We're seeing where we're talking about evacuating people out of the areas, but then the government is trying to push back people out of shelters back into areas that they evacuated. So I am not convinced that there is a well thought out plan to get this thing done. There are a lot of meetings and a lot of plans, but there's a mismatch between execution and the directing of resources to where they are needed most. And priorities are misplaced as well.
I want to go back to evacuation, Dr. Dawes. Tell us some of the things that the evacuation could have prevented or can help to prevent, because I am of the opinion that even at this stage, they are saying that it's over 1,400 people who are still in shelters. Those people need to be evacuated to a proper holding area, a proper area set up for these people. Tell us some of the things that could have alleviated if we have done some evacuation.
Well, most of the persons who have died from leptospirosis, they would have been in areas that were badly affected, where there are pools of water and so on. Had we gotten people out of those areas, I believe that would have had far less cases and would have prevented a few deaths. There are some uncounted deaths that are associated with poor outreach after the disaster. Some people have gotten strokes and died. Some people would have gotten heart attacks and died. What's going to be written on the death certificate is that they had a stroke or they died from a heart attack. It's not going to be because they never had any medication, they had no way to access health care, they never got medical attention before their chronic disease took them out. So they would not have been counted as casualties of the hurricane. And this is why I said very early out that more people will die after the passage of a natural disaster than during that natural disaster. And I think what I said, 40-something people died. I can't remember the exact number.
45.
From
16
45.
still on account. 16 people
Right.
can't be found.
And already from leptospirosis alone, we have about 14 deaths. And we have the unaccounted ones who would have died as a result of complications from their chronic diseases. And it's going to get further along the further we will get away from the storm. Mm-hmm. The persons who have been indirectly impacted, more and more of them are going to die, but they won't be counted. But we will see some excess deaths, people who would not have died before the passage of Hurricane Melissa. Because of the hurricane passing, they are going to die now because of a disruption in their lives, chronic diseases as well as infectious diseases. And I pray that dengue does not hit us the way it is now in Cuba, where you have about 3 million people or more than who the entire population of Jamaica have been affected by dengue, chickpea, and other mosquito-borne diseases.
And that's after Hurricane Melissa?
It has started before, and it has gotten worse now, but it's the same thing. If you look on the risk factors, why they said it was an issue. They didn't have enough garbage collection. They had issues with sanitation. They had poor control of mosquito breeding sites. And as a result of that, they had the outbreak, and then the hurricane just made it worse. We have those same issues grappling with here in Jamaica, plus more people are homeless. You know, and I said at the press conference that maybe we should be looking at the distribution of mosquito repellents and nets.
Yes,
because if we don't be proactive, then you're going to see the spike in cases, and then we're going to be reactive again. And for some people, that reaction will be too late.
If you're just joining us, we're talking to a member of Jamaica's House of Representatives, Dr. Alfred Dawes, and he's the Shadow Minister of Health right here in Jamaica. Dr. Dawes, when you look at the whole management after the storm, because people love to talk about nobody could have planned for a Category 5. That's behind us. The Category 5 happened. What have we been doing since that time? How have we been dealing with the citizens of the island? How are we been sorting them out as it come down to living in areas really affected badly by the storm? As Dr. Dawes said a number of times, people are homeless. And the fact that they are homeless, it put them in a position where open defecation is taking place. Dr. Dawes mentioned this early, people bathing in the rivers that just pop up out of nowhere, in gullies that they're right at them yard, people feeding the animals with those waters, and hence you have things like leptospirosis and all of that takes place. Dr. Dawes, how do you judge the government on what is happening right now?
I would give them a failing grade because they have spent more time congratulating themselves on doing the most basic requirements of our government, meaning that they're going to say we clear the roads, and that is what allowed the volunteers to be going down there.
Yes.
You know, the fact of the matter is that about 90% of the aid within the first 2 weeks were all volunteers. And I say that unrepentantly because I was there on the ground, and you didn't see the government. You didn't see the all of these ministers and even caretakers where they don't have MPs distributing food now. They were absent. It was volunteers who were down there. And they were the ones.
And we see government ministers now going down there, and they're going in their personal capacity as volunteers too. They take it on.
It's PR. It's PR. And this is why I said that the efforts are not coordinated, because they're going into the same areas, and some people can stock out a wholesale now. And then you have the persons in the interior communities. We made a wrong turn one day. A group of us were going to do a health fair, and we stumbled upon a community, not even on the map. We asked how we find them. They said, look for that community, and we are in between. And they say helicopter fly overhead. They say cars drive past, but nobody stop and give them anything. And we were the first to take out some of our supplies and give them some bleach, give them some sanitary napkins, some basic items. And they were so grateful for it. But you see, there is no proper mapping of the disaster areas to ensure that people would get supplies. You know, it's sometimes, you have a thing called with triage in medicine. Mm-hmm. When you have a mass casualty, the people who bawl and moan the most are the ones who you naturally want to go to, because you think that the attention that they're calling for means that their condition is more serious.
Yes.
A trained emergency physician would look for those who are quiet, because they're the ones who don't even have the energy to talk and call for help.
Yeah.
So what we have been doing is that we have been going to the people who have been balling out the most and the ones who are obvious because they're on the main. And we're missing the ones who they're marooned or semi-marooned, and you can't get to them, so therefore you do not know their conditions. As a matter of fact, the entire Eastern Hanover, because nobody has been talking about Eastern Hanover much.
No,
Those
Hanover don't get much
communities,
talk about.
and they are suffering. There are communities where gullies pass through people's houses. There's a stench in some areas, and you don't know what is causing it. And it's just a matter of time before the marginal communities, you end up with major outbreaks. So I don't, to just dismiss concerns to say cases will rise, cases will fall eventually as the disease burnt out. There are casualties. They're not cases, they're people. And it's not just the fact that you catch a disease, the fear of catching the disease is palpable. Every time somebody feel a little fluish, they're wondering, is it this now?
Yes.
But they can't get tested to get some reassurance. And it's flu season we're going in now. And
Yes.
everything feels alike. The dengue, the leptospirosis, the influenza, they all start out with some fever. And it does, as Jamaican love call it, low feeling or bad feeling.
Yeah.
And everybody feeling that right now. They are paranoid, they're panicking. So the anxiety levels added to people whose entire lives and lives have been disrupted is high. So we can't just count cases. We have to think about people's feelings.
The next thing, Dr. Dawes, is there a research done or they have a way how they are going to check people who lost their mental capacity since the hurricane?
Anecdotally, speaking to a psychiatrist in Kingston, he said about 1 in 4 patients right now are coming in with hurricane-related mental conditions,
One
meaning
in
that,
four.
and this is Kingston, and people are thinking that because we were spared this side of the island, it is not affecting us. Jamaica is a small place. All of us have a relative,
Yes.
a friend out west, and we're concerned about them. And it is just and seeing the images, and if you have been down there, it's even worse. It's taking a toll on us. Anxiety is being made worse. People never know that they have anxiety, finding out now with panic attacks and heart palpitations. Depression is on the increase, and for those directly affected, post-traumatic stress disorder, PTSD, it is going to be something that they have to deal with for years to come. And if they don't heal properly, it's going to lead to maladaptive behaviors. Who a lot of people are forgetting about are the children. Surviving a hurricane is a traumatic childhood experience. Surviving a hurricane, losing your home, losing your parents, seeing your parents stress, don't know how you're going to get back to school, disruptions in school, that is a major childhood adverse event. And all of these things predict whether or not you are likely to grow up, have dysfunctional relationships, have bad financial outcomes, substance abuse, obesity, and even the risk of getting chronic diseases. So you have an entire generation now of children who have been scarred by this hurricane. And if we don't get to them and allow them to heal properly, the emotional scars that they're going to carry is going to affect them years to come. And they'll pass on that trauma to their children. So the parents may be a little bit more numb because when you're going through something, the natural thing is for your body to numb it down and not feel the pain. So they're not going to be talking about their feelings and all that. But you'll notice in conversations with persons, there's a returning residents couple out west. They had saved up their entire lives abroad, returned home to their country, and it's the greatest thing for people living overseas to come back and retire in Jamaica. When they have lost everything, they can't return. And in speaking with a friend of mine, all the man was saying repeatedly, we have lost everything, we're scoundrels now. We have lost everything, we're scoundrels. And the fact of the matter is that it is, imagine immediately all of your years of hard work just stripped away. You cannot tell a retiree that they're going to start over and build back again.
They just don't
And
have
a
the
lot of
capacity to
people
do
are
that.
like that. They just don't have the capacity. Yeah, businesses that took years to build up. I mean, even if they got insurance money, you're going to put back all of the insurance money in the business and then you don't have nobody to sell to. The economy is going to take a little while to go back. Farmers are afraid. There's a fear factor now with farmers. They got a lick last year with beryl,
Yes.
and they're recovering, and then they get a lick again this year. There are some fields that are going to be empty because they're afraid to put that money into farming. And what that is going to mean is that food prices are going to go up, and especially in that area, vegetables are not going to be so easy to come by. Already we're seeing where diets are crackers and tin food,
Yes.
processed food, that sort of thing. Fruits and vegetables. You can't be telling people to eat healthy for now when all them have is in the care packages is tough crackers and sardine and mackerel.
Dr.
So,
Daz, I'm not going to keep you much longer, and I'm going to ask your permission if I can take a 1 or 2 questions for you from our viewers and listeners, if that is all right with you.
Sure. Well, I was hoping to wrap up now, but
Yeah,
I
man,
can't.
But there's just one question, Dr. Daz. People with regular illness like the diabetes, high blood pressure, people in the West who have kidney disease, heart disease, what are they going through right now? Some of them even living in areas where it's difficult to get out and get to medical attention.
Well, everybody who is on insulin and they lost electricity, they don't have any insulin all of a sudden because it's spoiled. That's at one extreme. There's no way to really monitor people's blood pressure and glucose unless you're talking about the health fairs or they going into those communities. So we don't know what the level of control is like for the blood sugars and the blood pressures. And this is why I'm saying as a result of the displacement and as a result of the passage of the hurricane, the uncontrolled diabetes and high blood pressure, they're going to take a toll on people's lives, and it's not going to be counted because, it's so far from the hurricane. But the passage of the hurricane with the uncontrolled sugar for the last month, going into 2 months, 3 months, you're going to have those persons, unfortunately, some people are going to die because of that disruption.
Wow.
And it's not something that we can do much about if we don't solve the issue of getting them back to a place where there's some degree of normalcy to their lives, where they can take the medication, they can go to clinics, etc.
That's why.
And
that's why we say there should be some level of evacuation out of those areas. We think the government has dropped the ball on that.
Definitely.
One question for you, Dr. Daz. We have a caller. One question for Dr. Daz. Go ahead.
Morning, Dr. Daz. I greet you well, A quick...
Mystical, we're not... go ahead, speak up a little bit louder for me.
Morning, Dr. Daz. I greet you well. I heard the Prime Minister about people coming in from different parts of Africa to do...
Restart the question.
Volunteer work.
Excellence. Restart.
To do volunteer... No, I said... I heard the Prime Minister talking about people coming from different areas in Africa to do volunteer work. Situation and the endemic nature of cholera in some African country. What is your proposition how to treat with these guys who are coming in, especially in an attempt to reduce the introduction of cholera in Jamaica, which was seen here since the middle 1800s? $1,800.
You heard the question?
I'm not hearing clearly, but it sounded like trying to prevent the introduction of cholera.
Yes, I'm talking about some people who are coming from Africa to be volunteers.
Well, when I mentioned that the co-chair of the emergency committee called me disgraceful for saying that I am saying foreigners are going to bring in cholera to Jamaica. And look how many tourists come to Jamaica and we don't have cholera. And it smacks of a basic understanding of public health. Because what the caller said is right. You have persons who are coming in from areas where diseases are endemic, meaning that they naturally have it there. They may not have outbreaks, but they might have the 1 and 2 cases per year. The way we have dengue here right through and lepto right through, but they don't have a spike to call it an outbreak. People can be asymptomatic carriers, meaning that they carry the virus, but they don't show any signs and symptoms. But once they bring it to a vulnerable population, then they can contaminate the areas, whether it's through water or whether bad vectors get infected, and then they would have a disease outbreak in that population. It happened in Haiti 10 months after the hurricane, the earthquake, and it was UN soldiers who brought it in, the cholera. We also have malaria close by in Haiti, and we have a very vibrant Haiti to Jamaica trafficking route, so you don't know what might come. We can't really test everybody coming in because, like I said, they may be asymptomatic and not showing any signs. You wouldn't be able to see who you would be able to pick up that way with mass testing. But we know what a vulnerable population is who would be exposed to any introduced bacteria or viruses.
And
a vulnerable population is people living outside.
So you'd call down a West vulnerable?
Yeah.
Dr. Dawes, anything finally you want to add before you go?
I would we just have to hope for the best right now. This is a long haul situation.
Hope is not a strategy, Dr. Dawes.
Yeah, but if we as a people can just hope and pray a little bit more, maybe, God have some sympathy on dumb animals.
But what is the strategy? He gives us wisdom, knowledge, and understanding. We must put a strategy in place.
We have aired all of our concerns to the government, and all they have done is grandstand and congratulated themselves on the awesome job that they are doing. So what are we going to do? We unfortunately live in a Westminster system where the winner takes all, and they don't have to consult or listen to anyone. So they have taken over full control over the relief process and the rebuilding process. So we just have to hope that they are doing a good job as we continue to make suggestions publicly. But we still have to hope and pray that we don't have a worsening of the situation with further outbreaks.
Thank you, Dr. Dawes. A pleasure talking to you.
Likewise.
Yeah, man. Dr. Alfred Dawes, listeners and viewers, Shadow Minister of Health right here in Jamaica.